Hey there, my name is Reagan Gallagher, and I'm an intern here at the Center for Growth. Getting a diagnosis of functional neurological disorder, or FND, can be a challenging experience. It can often feel overwhelming and confusing. Regardless of where you find yourself on your journey with FND symptoms, gaining insight into yourself and your symptoms can be empowering and can lead to positive change. One really valuable tool in this process is the 5 areas assessment, a widely used method for examining the impact of FND symptoms on various aspects of your life. By delving into these 5 key areas, the assessment provides a really comprehensive framework for evaluating how these aspects influence the manifestation of and progression of your symptoms. These 5 areas typically include your physical health, emotions, thoughts, behavior, and the impact of these symptoms on daily activities. In this video, I'll give you a quick overview of some of what this assessment includes. So the first area and step is to map out your symptoms. In the intricate landscape of FND symptoms, the first really crucial step towards gaining control and insight is to meticulously map out the nuances of your own unique experience. This process involves introspection and a thoughtful examination of the symptoms that you're encountering. You can start mapping out your symptoms by asking yourself some questions like these. What's the symptom? Where did it first start? How often do you have it? What helps or what makes it worse? By systematically addressing these questions, you can create a detailed map of your symptoms that serves as a foundation for further exploration and discussion with healthcare professionals or loved ones. So the next step is to understand your thinking. The journey of your symptoms can be fraught with overwhelming emotions and apprehensions about the future. It's not uncommon for individuals to experience feelings of fear and uncertainty, prompting others to give well-intentioned but sometimes unhelpful advice like just don't think about it. But dismissing or suppressing thoughts about FND often proves counterproductive. Attempting to avoid these thoughts can paradoxically intensify their presence. Engaging in unhelpful thinking styles can set off a chain reaction, influencing mood and behavior. Negative thoughts may intensify feelings of stress or anger, prompting a tendency to avoid activities that provoke your stress. This avoidance can then hinder your coping mechanisms and contribute to a cycle of reduced engagement with life. So that's why it's so important to gain awareness of these patterns. Individuals can actively work towards cultivating a more balanced and constructive mindset, which can then foster resilience in the face of these FND symptoms. The next area 3, is exploring feelings and emotions. Understanding and navigating emotions is a really deeply personal journey. The 5 areas assessment places a really big emphasis on discerning the intricate relationship between emotions and symptoms. Start exploring some of your feelings by asking questions like these. How do you experience emotions? Do certain emotions trigger or intensify your symptoms? Are there patterns in your emotional responses to symptoms? It's recommended to discuss these reflections with a healthcare professional or loved ones to just enhance the effectiveness of the assessment process, to give you a chance to work all of it through. The next area is addressing altered behavior. So with FND symptoms, the impact of negative thoughts and emotions extend beyond the internal realm. They can manifest in observable changes in behavior. Recognizing and understanding these behavioral shifts is a crucial aspect of the 5 areas assessment, providing a comprehensive view of how symptoms influence the way individuals navigate their lives. Some reduced activity could include avoidance or social withdrawal. It's important to map that out and keep an eye on it. The last area is situation, relationship, and practical problems. In the realm of FND symptoms, the impact goes beyond the individual thoughts and behaviors and can go into the fabric of daily life, relationships, practical circumstances. The last area of the 5 areas assessment goes into these external dimensions, encouraging individuals to reflect on how FND symptoms influence their situation. Some areas to begin to think through or map out might be occupational challenges, educational impacts, financial considerations, and relationship dynamics. So that's it. That's a little bit of the 5 areas assessment. If you want to learn more about this tool or how to manage FND symptoms, or if you want to process any reflections you've had during this video, feel free to dial the number on the screen to be matched with a therapist here at the Center for Growth who is ready to talk through your symptoms. Thanks.